Hello, CRNA clinical preceptors. This is Dana Flatley, and I'm the program director for Millikin University in Decatur Memorial Hospital. I've created this video to provide some background to an update that you will see beginning August 21st on our clinical evaluations. The Council on Accreditation of Nurse Anesthesia Educational Programs revised the required clinical experiences for students entering the program on or after January 1st, 2022. One of the additions to the required clinical experiences is that nurse anesthesia students must perform a general anesthetic induction with minimal or no assistance. There are several reasons for these revisions, and this addition in particular. Most importantly, we must provide opportunities for students to develop into competent, safe nurse anesthetists capable of engaging in the full scope of practice. If you're interested in reading the guidelines, I've attached a link to the entire document on this slide. The COA guidelines are resources for students and program administrators. I've attached the guidance specific to the clinical experience of performing a general anesthetic induction with minimal or no assistance. You can see that there's a number in bold, and this is the required number for graduation. So the COA requires that students perform a general anesthetic induction with minimal or no assistance for at least 50 cases. The preferred number, however, is 100. The interpretive guideline tells us that to meet this clinical experience, the student must conduct a general anesthetic induction, including applying standard monitors, pre-oxygenating, selecting and administrating induction medications, managing the airway and ventilation with minimal or no assistance. The guideline also tells us that we have to establish a way to verify that the student was given these opportunities and they actually performed this clinical experience as it's defined. They also provide us examples. So in this first example, it says that the student performed the induction but had some problems maintaining the seal, and the CRNA gave some verbal guidance. Then the student was able to fix the issue with the mask and then move on and make adjustments and continue with the induction. This would meet the clinical experience. In our second example, we have a student that just was not able to manage the induction portion without more guidance, or maybe they needed help with direct laryngoscopy or masking. This would not meet the clinical experience of performing a general anesthetic induction with minimal or no assistance. However, it doesn't mean the student can't count the case as a whole. They just can't take credit for this higher level of clinical management. To meet the requirements set by the COA, that we must establish a mechanism to verify students did in fact perform a general anesthetic induction with minimal or no assistance, Millikin University and Decatur Memorial Hospital's nurse anesthesia program has added this statement to the back of clinical evaluations, beginning with clinical practicum 2. And the statement is simply pulled right off of the COA guidance. You can see that this statement also includes a place for you to write down the number of cases that you observed the student doing a induction with minimal or no assistance. It could be one or more cases that day, and we ask that you initial this particular statement. The comment section is still reserved for your comments that you provide the students for the entirety of the clinical day. However, if you have comments that are specific to the induction, you can certainly put them here as well. But again, this will be the mechanism that we use to track the number of inductions that the students performed with minimal or no assistance. On behalf of Millikin University and Decatur Memorial Hospital's Nurse Anesthesia Program faculty, I would like to thank you for listening to our update to the clinical evaluation. I would also like to thank you for serving as clinical preceptors. We understand that it's a thankless job, but it is so important. If you have any questions or concerns or comments, please email or call. Thank you.